transverse process of the lumbar vertebra. So transverse process it extends laterally from the junction between the pedicle and the lamina. So the transverse process is slender, that's thin except for the fifth lumbar vertebra, so where it's substantial, and this anterior surface of the transverse process it provides attachment to two muscles medially to the psoas major muscle and laterally to the quadratus lumborum. Between these two, you will get a ridge, a vertical ridge, which gives attachment to the anterior layer of thoracolumbar fascia. Tip of the transverse process gives attachment to the middle layer of thoracolumbar fascia, and you observe the posterior surface of the transverse process towards the posterior inferior part. It bears a small tubercle or a process, and this process is known as the accessory process. So here you can see this is the accessory process, which is related with the attachment of the medial intertransversus muscle. And coming to the transverse force of the L5 vertebra, it's substantial and it's encroaches towards the body rather than the junction between the pedicle and the lamina. And the tip of it gives attachment to two ligaments, that is iliolumbar ligaments and the lumbosacral ligaments. So that's all with the features of the transverse process. Now next we can move on to the articular process. Articular process extends upwards and downwards from the junction between the pedicle and the lamina, and each process spheres the facets, superior articular facets and the inferior articular facets. So in case of a typical cervical vertebra, this superior and the inferior articular process, it forms an articular tubercle, articular pillar. So this is known as the articular pillar, and this lateral part of this articular pillar, it's grooved and it transmits the dorsal rami of the uh, cervical nerves. Yeah. So lateral to this articular uh, pillar, this it transmits the dorsal rami of the cervical nerves. So this upper part of this articular pillar, it forms the articular facet, and the lower part it bears the inferior articular facets. So superior articular facet and the inferior articular facet. So if you see the shape of the superior articular facet, it's flat and it's facing upwards and backwards. And inferior articular facet is also flat, but it faces forwards and downwards. So this is the side lateral view of the uh, superior and inferior articular facets, and it articulates with the adjacent vertebrae to form the zygapophyseal joints. And here, due to the shape of this articular facet, it provides flexion and extension movements, and also it provides the limited range of the lateral flexion and the rotation here. But coming to the features of the articular facets of the thoracic vertebra, the upper or the superior articular facet is flat and it's facing backwards and somewhat laterally. So mainly it's facing backwards and it's flat, and inferior articular facet is just opposite, facing anteriorly or towards the front, and it's also flat. So here you can see in this picture here, this superior articular facet is flat and it's facing backwards. Inferior articular facet is flat and it's facing forwards. So due to this type of articulation, it permits only or it facilitates only the rotatory movement than the other. So next is the articular facets of the lumbar vertebrae. The superior articular facet is concave and it faces uh, backwards and medially, and the inferior articular facet is convex and it faces uh, forwards and laterally. So this is backwards and medially. Here. Posterior border of this superior articular facet bears a process, a tubercle, that's known as the mammillary process, and this mammillary process it gives origin to the multifidus muscle and the medial intertransversus muscle. So here you can see this is the mammillary process. So that's all with the uh, feature of this superior and the inferior articular processes. Here it doesn't give any rotatory movement in this joint between this superior and inferior articular facets between the lumbar vertebrae, which mainly provides the flexion, extension, and the lateral flexions, but it doesn't give any rotatory movements. That is limited due to the position on this shape of this articular facets. So next is the spinous process. The spinous process is both lamina fuses posterior at the midline to form the spinous process. So here you can see this is the spinous process. Both lamina fuses posterior at the midline to form the spinous process. So in case of typical cervical vertebra, this spinous process is horizontal and it's short and it's bifoot, and it provides attachment to a fibrous band which extends upwards towards the external occipital protuberance and to the external occipital crest, and that fibrous band is known as the ligamentum nuchae. So in case of thoracic vertebra, the spinous process is elongated and it has got a downward inclination. And in T5 to T8, it will overlap one over the other, and it provides attachment to supraspinous and the interspinous ligament. And towards the lumbar vertebra here, the tip of this spinous process, it here it's somewhat uh, hatchet shape. Here you can see, yeah, it's quadrilateral outline, and the tip of it gives attachment to the posterior layer of the thoracolumbar and remaining part of the spinous process, it gives attachment to supraspinous and the interspinous ligament. So that's all with the spinous process.